A new variant of this virus is emerging in Brazil as COVID-19 patients there are already dying of suffocation. It's not a game, she says. Where is the oxygen for the hospitals?
There's pressure on this virus to change. The more it circulates, the more opportunities it has to change.
The World Health Organization held an emergency meeting saying countries are now in a race with a virus that continues to mutate.
The virus has been energized by the ability to evolve and become better and fitter and better adapted to infecting us.
3 variants, first identified in the UK, South Africa, and Brazil, are now stalking the globe. In the UK, scientists identified mutations in the spike protein that appear to have made it more contagious. Variants first seen in South Africa and Brazil also involve tiny mutations on that spike, changes that could make it harder for your antibodies to recognize the virus and destroy it, even if you've been infected before.
We don't have, I think, sufficient data yet to say unequivocally these are variants that are able to get around our immune system, but they may be able to modify or lessen the response for our immune system.
A possible case of reinfection has been identified in Brazil. Britain's already restricting flights from South America. Canada is considering it.
Our measures have been very strong, but we're always open to strengthening them as necessary.
So far, Canadian labs have identified fewer than 30 variant cases, but some aren't linked to travel, and scientists are concerned.
I fear that what we see, right now is just the tip of the iceberg.
The advice from Canada's health minister?
Please keep asking yourself, do I absolutely need to go out today? Can I reduce the number of times that I am going out?
She adds public health measures can still defeat these new variants, but they have to be followed. Christine Birak, CBC News, Toronto.
Well, the COVID-19 variant is one of the things I want to talk to Dr. Zane Chagla about, an infectious disease physician. And Dr. Chagla, how concerned are you about this variant that we've seen in Brazil?
Yeah, I mean, as we're describing genetic mutations going across the world, this Brazilian variant has some of the components of what we saw in the UK with the increased transmissibility component, but it also has this other mutation where it bends the spike protein a little bit, which may lead to less antibody binding, which may lead to a lowered immune response or a lowered vaccine response. Now, it's not going to be zero, but it may not be as optimal as some of the other wild type variants we see out there. So, there is concern. It does need to be mapped. And I think as the vaccine process moves forward, we need to see if this is occurring in people that have been vaccinated.
And quick question I want to touch on. There's been some talk, particularly out here in British Columbia, of should there be a travel ban against interprovincial travel from an infectious disease standpoint. What's your view on that?
I mean, all of Canada is in areas of high epidemiology and low epidemiology. That mixing between different epidemiologies can lead to outbreaks, particularly as places are so fragile. And so, the encouragement is to people to stay home as much as possible. Minimizing travel makes sense other than essential meanings and essential reasons. And yeah, I mean, I think it's a valid intervention, knowing that we balance the risks of people not getting to vacation or do their leisure activities.
All right. Dr. Chagla, thank you.
No problem.